Welcome to Voices in Nursing with Dr. Nozil, Care, Policy, and Leadership, the podcast where we amplify the voices that shape healthcare from the inside out. Welcome, Dr. Nozil, to the Voices in Nursing with Dr. Nozil.
Yes, I am Dr. Nozil, and I'm being interviewed today.
Yes. My name is Charmaine Augustine, and it is an amazing pleasure to be here to interview you on your show. And I would love for you to tell our audience a little bit about yourself because, number one, as a woman in business, a woman that speaks about balance, a woman who's very involved and supportive in the healthcare industry with
I am Haitian born woman. I'm divorced, have two children. I have a son and a daughter. Initially, I moved from Haiti to Florida, and then from Florida to New York. I stayed shortly in New York. Life in New York wasn't good for me. I had my first degree on business administration. Then when I was divorced, I said, well, accounting or business administration is not for a single mom. The kids was like a baby and a 1-year-old, so I went back to school for nursing. Because a lot of people will tell me that I'm good with nursing. So first I was a CNA, then I did LPN, and I did RN. I did my BSN at FIU, then I went for my master, then my PhD at Barry University.
We're going to talk a little bit about you impacting policy. Just the other day, Dr. Nozil was in Washington and she travels a lot for work. And talk a little bit about what are some of the changes that you are focused on making sure these things change. Just give us a couple of them that's right on your radar.
So I've been a nurse for 26 years now. My background is critical care. I've worked at CVICU, Neuro ICU. I've worked at ICU. I've also worked the emergency room. I've seen healthcare is going down the drain. I can tell you one thing that frustrates me. For the past 5 years, I started going to Washington, D.C. with the Black Nurses Associations, meeting the legislators to bring healthcare issues. Well, a lot of people tell me, well, you have your PhD, and then it seems like you're doing volunteer work because all this work I'm doing really doesn't bring me money, actually. It's just like advocating policies. Two things that happened to me professionally. I said, you know what? I have to get this podcast to start talking with the community to amplify our voices. I don't think our voices heard enough. We have a lot of people in healthcare. We have a lot of nurses. We don't have a lot of nurses in politics and policy to have a seat at the table for our community. Health disparities, and we can see what was going on during COVID. When you work on a hospital, you see that decisions are making, and then you watch on television, see what was going on with people, with patients, who has the ventilators, who can have it, who cannot have it. All this kind of health disparities that people were aware about it. They were there before, but it just wasn't televised. So with all of that frustrating and trying to focus to see how can I help educate the community to help them understand what's going on in healthcare, and then to encourage people on healthcare or healthcare providers or nurses to get into policy.
I think that's one of the reasons I was excited to interview you, because we talk about work-life balance and we talk about the physical wear and tear and what it takes, but the actual work that healthcare providers put in is not just those on the front line. It's those who are developing and being part of developing the drugs that are the right fit for different types of people. What someone who's African American or Black, they respond in a different way to certain medications, or it's not a one size fits all. And then of course, as you're saying, with making healthcare affordable, there's so many countries that have free healthcare. And are paid well. The nurses, like why cannot we make this a priority in here in America?
Besides that, there's a lot of other things that is going on healthcare. Although when healthcare start changing policies and decisions and it's changing, it's affecting nurses.
Yes.
It's affecting how policy in the hospitals work. Students. It will affect all of this. It even affect how we work. And then it can even affect us mentally.
Oh, absolutely.
We were supposed to go, and then the Saturday
Yeah,
of your birthday, we were supposed to go to
wine tour.
Wine tour.
Yes.
And then I went to Florida on Friday. My dad was hospitalized in a hospital. He was sick. He has respiratory distress. They put him on a ventilator. So I drove to Florida. When I get to Florida that night, it was a Friday around 10 p.m. I saw my sister was there and her husband. She said, well, it was a long drive for you to come back in the morning. I couldn't sleep. And then around 2, 3 o'clock, I was up already. I said, well, since I'm up, I might as well go to the hospital. Right. So I went to the hospital. I told my sister, I'm here. And then we start talking 3 o'clock. At 5 o'clock, there's a physicians that come in doing round. I asked him, how's my dad doing? He said, well, we're gonna wait in the morning. We're gonna get the family together so we can discuss the plan of care for him. But prior to that, when I came in around 10 o'clock, I reviewed all of my dad's vital signs, the ventilator, the blood gas, and I reviewed all of those as a rapid response nurse. So around 6 o'clock in the morning, his blood pressure was like 182 over 100 something. The nurse that was working that shift come in, give him some hydrolyzine. Then 7 o'clock shift change, another nurse come in. I was there talking with the nurse, and I've noticed on the ventilator, his oxygen saturation is dropping on the 80s. Helping us, what's going on, his saturation is dropping. Whereas the respiratory therapist called them to check the vent to see what's going on. Blood pressure is dropping also. So blood pressure was like 76 over 43. She went and get the drip, liver fed. So once they put the liver fed, send a message to the physician because the physician wasn't on the floor. My dad is crashing. You need to titrate the drip so we can increase the blood pressure. But now it's another thing. My dad is crashing, so I have to say something. Blood pressure drop again, 43 over 30 something, 27. Then I was like screaming and yelling, call the code. There's no doctors, nobody's there. I was like calling for 15 minutes. Nobody showed up and my dad coded. They tried and tried, they could not, and my dad died. And I was devastated. I've worked. I've saved so many lives, and then this is in front of my eye. My own father, I could not save these lives. Wow. I was devastated. I had to cancel them because mentally I could not do it. Then the doctor told me his reason for not being there is because they had another code. So it's just like I told the doctor, you failed me. My colleague failed me. I spoke with the nurse too. I said, we are supposed to be a patient advocate. We are supposed to be the angel. You just killed my dad in front of me. I said, you could have called the doctor, call the code, get somebody else in here.
And again, I empathize. I completely understand the pain of watching your loved one die, because I saw my own husband die in front of me with my own eyes just a few months ago of a heart attack. And just speaking of wherever you are in the world, or wherever the person may get ill, knowing that, whether you had control, whether you could do anything or not, but the fact that you were saying that there was only one doctor or there was no doctor for a certain number of minutes. And yes, of course.
Because I could not function. The guilt that I had. I could not function. I had to have counseling. I'm thinking, with that nurse, how you a nurse watch somebody die, and then it was wrong for a nurse to have somebody that is under critical conditions, and then you have somebody else training somebody else, and then that nurse had another patient on CRRT. CRRT is a continuous dialysis they're doing for patients.
Which also just leads to that balance, for me, a personal story, stress kills, right? It just goes back to why you're doing what you're doing, and even more now because it's your lived experience. And I'm really glad that you talk about therapy. And go through counseling. As I said, I'm a huge advocate. Anyone who's in healthcare, anyone who's dealing with anyone else's issues, whether it's mentally, physically, or whatever, you have to make that almost part of your routine, especially going through, the guilt. You've been in healthcare, you were there, you knew what to do if you were the one in charge, and why you will continue to advocate, who do you go to first? And also, we talked about this, the staffing. You're training someone, when someone is having a critical manifestation in front of you, blood pressure's dropping to 40 over 27, that's not the time to turn your back and train somebody. And say, well, this is how you would send a message.
And then people may not like what I have to say, but I'm gonna say it anyway. Because I've always said, if I could not help my dad, I would help somebody else. Because in the hospital, although I'm a nurse, is when they have policy. For instance, short staff. When you're short staff and you have critical thinking, now your nurse is going to be decided who can die, who can leave. And one thing that they asked me, what is the quality of life for that person? My dad was 88 years old. The quality of life for them may not be quality of life for me. For me, he had a good quality of life because at 88 years old, he was sick, problem. He could not walk. He has COPD. He has good quality of life. On the 11th of July, I was tired, sleeping on his couch. He made food for me. He made dinner for me.
He was living his life and with his loved one. So I really love your why, and I'm glad that we have a story behind it. And we have the rise of a woman who's rising to a greater purpose from being divorced in the Northeast, figuring out how you're going to do this, and then realizing that truly is your calling. And everything has a silver lining. But you started by going in and getting your certification as a CNA, and that was your end. Now we're at your office. We have a beautiful studio. We've got a lunch room, we've got a restroom, we've got a sitting area, we've got a welcome area, and we have a classroom. I am so impressed because I walk in and there you have your binders. Tell us about what that classroom is set up for. Let's talk about your upcoming program.
The GA Healthcare Training and Consulting, that is the same school that sponsor the podcast. So I started the nursing assistant school just to train individual. And as you see those binders on this curriculum, this is a curriculum I do it with my hands because what happened with my dad and what happened on the healthcare, I want to tell that story over and over again. So people can understand when you're at the bedside taking care of somebody's life, it's somebody's loved one, you have to, we focus on quality care. Where I've trained individuals to become a CNA, and I also trained the CNA to become a medication assist where they can help work at a personal care home, assisted living facility, and nursing home. The CNAs also do leadership development. So I go to hospitals, clinic, and train staff, train nurses. And then as an educator, I teach also fundamental nursing, also teach that. It's just to make sure that I care about policy, quality care, and then determination of health.
Right. So you
Left
are,
disparities.
yes, I mean, all of those, very important. So you are very busy, and I'm glad we talked about balance. And you talk about just, of course, women, whether they're in healthcare or not, but women who are leading and leaders in the healthcare field. What would you say to someone who wants to, and you gotta give them the good, bad, and the ugly. What would you say to someone out there who wants to get into healthcare following their path?
My advice with them, it's a beautiful profession. I love nursing. But you have to love what you do.
Yes.
Because you have to really care for patients. Because nursing, you find nursing everywhere. And you can work on hospital, you can work clinics, yes, you can do administration, you can do a lot. It's a beautiful profession. But you have to love nursing because nursing it's caring. It's the number one of professions. That's the biggest, largest profession that you will never imagine. Doing my PhD 5 years, taking 5 years. Nurse from college, 4 years college. As a foreigner, you have to take all these languages, all these English things that you have to take. 4 years of that, and 2 years of nursing, 2 years of a year and a half for my master's, and 5 years of PhD, plus all the other work that you have to continue to do, continuing educations. And right now, my focus is really on advocacy and policy. Yes. Really focus on that because I wanted to help the community. I wanted to tell them exactly what happened on healthcare. It doesn't mean that they're not doing good care in healthcare, but family members, they have to be in the hospital and ask questions. Imagine me as someone who's experienced, who knows, and then they're doing that to my dad. How about people who don't know? Absolutely. Be on the show, let your voice be heard. She is taking this all the way. She's advocating, she's spending out of her own pocket. It's an unpaid what she's doing, but she's doing it it's unpaid monetarily, but it is paid with being satisfied and knowing that there's so much that she wants to pay for it. So even with starting with training nurses, certified nursing assistants, and having them educating the community too. Exactly. Because I want the public to know, talk about what's going on in healthcare, and be open about so people know. Because I have really had a really bad experience, and I would not want that for my worst enemy. And there are a lot of behind the scenes that happen from the policies and the paperwork to the business side of it. Yeah, let's say for instance, if you work on a hospital, there's a policy, they're doing something like you have your patients, you notice that the hospital don't have a policy for certain things. Like if you work on a hospital as a critical care nurse, you have a patient that is dying in front of you, and then they give you somebody to orienting. You have to have your boundary to say, well, this patient's not doing well. I don't think I can orient people. You have to be able to stand up and say that. And then that there's discriminations in the hospital that you work at a place, you have to call them out on that. There's a UPC things that this is where nurses can start or healthcare provider can start be advocate for your patients. Now, I know, Dr. Nozell, that you do speak to organizations, you do use your podcast as a voice. You're very well known in our circles. How can someone get in touch with you? Yeah, I have a website that is gahealthcaretraining.com. It's GA, like Georgia, healthcaretraining.com. I have the website, the school website, every courses that I offer is there. And a lot of other things, like you can email me on ynozil@gahealthcaretraining.com. You go to the website, you can see all the amazing things Dr. Nozell is doing and has done.
get to know her some more on the professional side and a personal side. She's been very open, very vulnerable with her own life from, where she's coming from to now in her lived experience in healthcare, not just as a worker, but as a family member. So definitely check her out. And if you know anyone, wherever they are, because I know you do virtual as well, and they're flying for some practicum. But if you know anyone that is thinking about, they might want to get into healthcare, or they might want to get certified, or they might want to get a CNA certification, please reach out on her website. You can contact her from there, email, phone call, have any questions. She really is that girl. We call her, I have her in my phone as Dr. Nose. I call her Dr. Nozell. She deserves it. Someone that you want to get to know, and the reason she's doing what she's doing comes from the heart. Dr. Nozell, I have got to tell you, my love, this has been an amazing interview. Thank you for the opportunity. I'm glad it worked out, because I really feel like there's so much that you do out front, but there's so much that you do behind the scenes, and this is a platform to help people. Yeah, and that's what you do. Yeah, so and then anybody go to YouTube, you put Dr. Nozell, and then you will see all the episodes on podcast. Yes, so Dr. Nozell on YouTube, DrNozile. Follow her on YouTube. Keep abreast with the podcast. You can just always refer back to it if you want to hear something or want to know something. She does a great job with the folks that she has on her show to add value to the community, to add value to the healthcare industry. Yes. Let's learn, let's lead, and let's shape healthcare together. Until next time. Bye.